Hello, I'm Cindy Arenberg Seltzer, President and CEO of the Children's Services Council of Broward County. Welcome to another episode of Future First, Focus on Broward's Children. Over the years on this program, we have shared information on available resources reflecting the highest standard of quality our community should expect. Today, we'll go behind the scenes and talk a little about how we work collaboratively to attain those superior standards in the child-serving community. If you are a working parent who relies on an after-school program or a child care center, a caregiver to a child or youth with special needs, someone who provides support to a child or youth who has been victimized by abuse, you want to trust that the professionals providing services to your loved ones are highly trained and can deal effectively with the situations at hand. The CSC began operations in 2001 in an environment where many organizations were providing trainings and often duplicating services. That's why we spearheaded the creation of what is now known as the Broward Training Collaborative, a structure that helps to streamline trainings of the highest quality to professionals in the child-serving community. In addition, always striving to be at the technological forefront, the CSC has recently launched a new initiative called the CSC's Online Learning Center. Here to talk about the Broward Training Collaborative and CSC training options, as well as those of our community partners, are Corey Yugler of the Community Foundation of Broward, Shannon, Rhodes, and Gwen Fuller, training specialists with the Children's Services Council of Broward County. Later, we'll hear from a trainer and two child-serving professionals who have benefited from these trainings. Hello, ladies.
Hello,
Hi,
Cindy.
It's nice to see you outside the office.
Yes.
Welcome.
Thank you.
So, Gwen, I'm going to start with you as the longest sitting CSC member
Yes.
among the group.
Yes.
You've been with us almost since the beginning of the training collaborative and helped take it from a group of folks sitting around the table saying, what do you do, what do you do, what do you do, and turned it into a structure. Can you talk to me a little bit about how you did that and what happened?
Well, the framework was there, as you mentioned earlier, but as we met, the Broward Training Collaborative continued to meet, needs arose that needed to be addressed, and we needed to improve our online registration. At that time, the registration was a paper registration. We moved it to an online registration, so that was a really big new initiative for the Broward Training Collaborative.
And actually, I'm going to take you back even a step. Let's talk about the different groups that are around the table that were there at the beginning. We had some universities, some nonprofits.
Yes, from almost every service line was there, from mental health providers that wanted to be at the table to talk about their training needs. We had after-school providers that were at the table that, again, wanted to talk about their training needs. As you mentioned, schools were there, Nova was there, Barry was there, the county was there, who was also providing trainings to children and adult service providers. So the Broward Training Collaborative started with a wide range of participants throughout the county that all had a common goal, and that was helping those that touch children be better prepared to do that.
And one of the amazing things that I often find is when you bring people together around a table and they all do similar things, how little they know about what each other are
Yes.
doing. Hence that idea of creating a space where they could do that.
Absolutely.
And actually creating that training calendar online. You want to talk a little, we spent a lot of time developing that online training calendar. You would think that would be easy, but not so much.
Well, we wanted to do a couple things. We wanted to provide for the trainings that CSC funded in this training collaborative, but we also wanted to provide a space where our partners could also put their trainings that they were providing. Because again, to remove that duplicity of trainings, a person could come, staff person in the community could come online and see what is the community offering. And so it was a really good place. We always talked about it as a one-stop for staff that work with children. They could see what the community had to offer as well as some of the trainings that CSC funded.
And speaking of CSC funded trainings, Shannon, you started out more on the program services side,
Yes.
helping to identify internally what trainings were needed. Talk about how you identified those needs and now how we've evolved as you've moved to the training side of the house.
Well, from the program services standpoint, when we were putting money into services out into the community, we really wanted to put some best practice models. And a lot of the best practice models used in the community have a very extensive quality training program that goes into that. So we wanted to make sure those trainings were accessible to the providers when they go and implement that model to help children and families. So that was how that piece got brought in. There's also, now we identify other trainings, other service provision trainings, even such as on topics such as grief counseling for children, such as depression, eating disorders in youth, working with defiant youth. Even to some more positive things into how to teach positive parenting skills to the families that the service providers are working with. So there's quite a bit of overlap there from our program services into our training. And through the collaborative, we're first able to identify, is this training already out there? Is someone providing this training? So we're not duplicating, but also to be able to identify new needs.
Over the course of the 10 years, we've improved our relationship, if you will, with the program services side of the house to find, because they're working with providers all the time. And so they're hearing what those needs are, getting back to the Broward Training Collaborative, letting us know what the community needs are. We've also included surveys to find out what they need. We started out with just surveys from the CSC, and Community Foundation had their survey, but we've now begun to put a survey together that speaks for the whole community.
Yes, and Corey can speak on that. We just did a collaborative survey.
Right. You know, what we found is that all the trainers had various needs, information that we needed to attain. And what's different in the service sector is that we really need to optimize our funds invested and our time invested. Unlike the for-profit side of the world, we're really trying to do more with less. And so one of the great things that's come out of the Broward Training Collaborative is that we are trying to do things to benefit the entire community. And certainly as a funder, we know that we really want to maximize our investment. And so that's one of the things that we did this year. We did a joint survey, and our intention is to share that information with the entire community and with other service providers and training providers so that they can really understand what the needs are of the community.
Mm-hmm. One of the other great things about the partnership with the Community Foundation, again, back to that, trying to avoid duplication. Mm-hmm. Community Foundation, through what was then known as the Nonprofit Resource Center, was doing a lot of the administrative trainings, those structural, because you have to have a strong foundation in order to be able to deliver the service. Mm-hmm. So the CSC sort of took on more of the programmatic side, and we funded you as a mm-hmm. matching dollars to do more of the administrative side of the house. Mm-hmm. You want to talk a little bit about that aspect?
Well, in what we say in the service sector, we call it capacity building. So what is the capacity of an agency to do its work? Certainly you provide that capacity in terms of direct service. How do you serve the children directly? From our perspective, we want to understand if those who are leading the organization can actually have the capacity to do this. So does the board understand what its role is? Because it's very important for what board members really provide a lot of value, and often they don't really know what their role is. Certainly when they start with some of our smaller agencies, they don't always know what they're supposed to be doing. Mm-hmm. Can the CEO provide the kinds of leadership? Do they know how to run an agency? Do they know what the budget pieces are? Mm-hmm. So what we do is we try to provide that kind of leadership, what we call leadership capacity building, mm-hmm. to really work hand in hand with what you're doing, which is provide the hands-on client service capacity building.
Mm-hmm. So important for that collaboration there, mm-hmm. because like you said, if the organization is falling apart, if they don't have a good handle on the finances, then it distracts the line staff from being able to do their job.
That's right.
And the target audiences for these trainings really are who?
They are really the service providers of families and children out in Broward County. Last year alone, we had 2,600 participants at the trainings that just CSC sponsors. And these can be all the way from your administrative personnel to your CEOs, some that Corey would service, to your middle managers, but to your hands-on staff that are working specifically and directly with the children and the families. So it really varies, the populations of our participants, but it's very broad.
And where do we find these trainers?
That's a good question, Cindy, because our trainers come to us from all different aspects. But I have to say, through the Broward Training Collaborative, we are really able to vet a lot of our trainers. People have used, to say Corey has, from the Community Foundation, maybe she's bumped into a very a source expert in, say, team building amongst teams for nonprofits. So many times we'll bring our needs to the Training Collaborative, and we're able to share our resources there.
And those trainers that are new to all of us, you know, we still have to go out and vet them. We'll go and watch them in action doing some training to make sure that we're choosing people that are right to provide the services that we're looking for.
So that we know that the trainings are very high quality.
Absolutely.
And at our favorite price.
That's
well,
right.
not quite our favorite price. We can't get them for free, but you
Very
guys do a
affordable.
great job at making them as affordable as possible. Now's a good time to hear from one of the many trainers that we featured at the CSC, Dr. Jennifer Becker, and 2 child and family serving professionals who have taken advantage of a number of our trainings over the past few years, Michael Allen and Colleen Ajuzma.
The trainings I do at Children's Services Council include adolescent victims of sexual abuse and their families. I do a training on the developmental consequences of child maltreatment. Also, family engagement, which is a training that helps practitioners learn how to engage families in the helping process. The Children's Services Council really handles all of the scheduling of the training and recruiting of the attendees. They set the schedule for me. It's really actually a very simple process. I've worked with them for years. They're phenomenal to work with. They do a great job of just making sure that there are enough attendees for and they advertise the trainings well enough that they're fully attended. The trainees are a wide range of practitioners in the field. They may work in the school setting, they may work in child protection agencies for the Department of Children and Families, or in clinical practice. It's a wide range of practitioners. The technology that's available is really the best possible setting for training, and the location is great, and I think that the attendees really enjoy coming to the trainings, and even when they spend a full day, it's a great place to learn.
I work for Covenant House, Florida. Covenant House is a crisis shelter, caters to adolescent, young adult, homeless children, both males and females who are in crisis situations. So they come to Covenant House for shelter, food, services, different services that we provide. The trainings that I've taken here at Children's Services varies. One of them in particular is working with victims of sexual abuse, working with defiant children also. That has been very helpful for me, especially in the environment that I work. It sort of helped me to understand the kids who I work with, understand their circumstances, and better able to deal with them on a one-to-one level. The trainings are definitely helpful for me individually, also for my organization, because what I have learned here, I'll be able to put it into practice where I work. In terms of cost, personally it doesn't come out of my pocket. It's the organization that pays for it. However, as I said, the training to me, they're very helpful. So even if I was paying out of pocket, it wouldn't be any problem in the sense that the knowledge that I've received, the experiences that I've received also, it's a tremendous benefit for me and also for the work that I do.